So I think partly it's going to be, well, probably a couple of things. I think there's a lot of stigma, right? So I would say that stigma is a really big challenge in the HIV space, and particularly both on the provider side, but as well as the patient side, right? There's a lot of internalized stigma sometimes, but then just people's perceptions and thoughts around HIV and kind of that discomfort with having the conversation. I think we're uncomfortable talking about HIV, but it starts before that, uncomfortable having conversations about sex in general and sexual health and wellness. And so if you can't overcome those hurdles or those barriers, then it makes it extremely difficult to have conversations about getting an HIV test, testing folks, diagnosing people who are living with HIV, but then also offering prevention options. So it really starts with that stigma and just this discomfort around having the conversation. And then I think the other would be lack of awareness. So I often hear from folks that, what do you do for a living? And I tell them I'm an HIV specialized clinician pharmacist, and they say, oh, HIV is still a thing. So I think there's still this lack of awareness around that HIV is still exists. It is still a challenge in this day and time. And so I would say those are two big areas that really prevent us from being able to move forward sometimes in this space. With the, introduction of long-acting therapies, both on the treatment and the prevention side, I think that those have really unlocked some key areas for us in terms of kind of dealing sometimes with that stigma, right? Folks, don't have to worry about having pills all the time at home, and the discomfort that comes with thinking about folks maybe seeing those medications. And so, that long-acting injectable option kind of gives you that freedom, if you will, of being able to kind of take control and deal with some of those that stigma around it, deal with some of that discomfort with people knowing about diagnoses, or folks who are just uncomfortable with people knowing that they're on PrEP. So it gives options for people to be able to address those things and deal with any of those discomforts or concerns that they may have. So that would be a big one. I think it also gives the opportunity for spacing out or longer intervals with dosing. So not having to take daily pills or having a daily reminder. Now you have medication both on the treatment and the prevention side with long-acting injectables, where you can actually go in every other month for your dosing, right? And you just need to show up to the doctor's office every other month, get your injection, and then go on about your way. So those are kind of some of the things that long-acting injectables have done for this space, that innovation, bringing that forward. Barriers, I would say I'll always, and I can't stress it enough, I'll always go back to stigma. I can't tell you how many times in practicing patients where, they would not want to be seen at the clinic, right? And so because there was this idea that everybody knows what this building is, and why you're coming to this clinic. And so being seen there was a challenge. And so it's that stigma, it's that, the just the negativity sometimes that has been surrounded by the HIV diagnosis and just even sexual health and sexual wellness. And so because now we can have where you can, use this discrete option of a long-acting injectable where you're only coming quickly, get an injection and go on about your way, that some of that anxiety and that discomfort and fear is relieved for folks. I think the other is, again, as I talked about, having to take medication daily and trying to remember to take that pill at the same time every day sometimes has been a challenge. And so you get this less frequent dosing with the long-acting injectables. It can reduce that mental burden. So I've heard many times where patients would say, taking the pill every day reminded me of my diagnosis every single day. But even further than that, for some, it reminded them of how they came about acquiring HIV. And so that can be very, that can be very concerning for folks and uncomfortable for people. So, the long-acting injectable, again, that less frequent dosing, you don't have that same kind of daily mental burden, if you will. And then there's always challenges with adherence when you're trying to take something every single day, right? And so now we can see hopefully an improved adherence with this less frequent dosing around the long-acting injectables. So I think a lot of that, the discretion that you get, reducing that mental burden that sometimes folks experience, and then also improving adherence is game changers, I think, with the long-acting injectables. Oh, I love that question because prior to joining ViiV and when I was in full-time practice, we had done telehealth. So I'm in Alabama, and we were centrally located in Montgomery, but we serviced 26 different counties in the state of Alabama. And we did that through telemedicine. And it was fantastic. I mean, our telemedicine rate of folks coming into clinic and showing up was much better than some of our folks who were having to come into the physical clinic setting in Montgomery. So again, that they felt like there was this discretion. I loved my patients. A lot of them would dress up because they felt like they were going to be on TV and like meeting with someone special and important. So it was really impactful to see kind of us use this digital tool with telemedicine to really improve adherence and really get people motivated and excited about being able to see their provider on their own terms, right, at a time that was convenient for them. So I think that is one of the tools in the toolbox, in the digital toolbox that we have. In terms of AI, I would say a lot of this being able to help us, identify who maybe is the best candidate for like prevention options, or being able to have these, I guess, algorithms that you will help us identify folks who might be good candidates for long-acting injectable therapies, or any therapy really, I think would be another way, kind of looking at some of the data that's coming out and some of the things that people are talking about when we go to these larger conferences around the digital space. So any of that, I think education probably is another big one, right? Being able to use some of this innovation and digital technology to be able to educate and raise awareness around HIV and sexual health and wellness. So yeah, I think digital is probably definitely the way to go. We definitely need to get on board with that to be able to help us in the HIV epidemic. Healthcare providers, I can't say it enough, are probably that really key and important, and an important link in terms of helping their communities that they serve and take care of, know about the vulnerabilities that maybe exist to contracting HIV, right, or acquiring HIV. I think that's a big piece in making sure that they are having those sexual health conversations with their patients in the communities that they serve, but then also taking it the step further to offer the HIV test, and making sure that they share that, in a non-judgmental, non-kind of biased way, that, hey, sometimes this is really about where we are geographically. That we see a higher prevalence here, so we really need to make sure that we're having a conversation about sexual health, sexual wellness, offering HIV testing, so that folks can feel comfortable doing that and moving forward. We see many times in some of our studies and the data that we have that the provider offering and suggesting actually is a really big motivator and a facilitator to getting people to do those things. So we can't just wait on the community and patients to tell us, hey, I would like this or I need this. We really need to be having those conversations frequently. And I think that helps us then raise awareness in those communities as well, around the fact that we need to, get that HIV test. There are prevention options available. So if that test comes back negative, I don't just stop there and say, great, your test is negative. As a provider, I need to move forward to talk about the prevention options that exist, pre-exposure prophylaxis, PrEP. And is this a tool that you can use in your toolbox to help you keep that test negative, right? The other piece is then when we test and we find that positive, then we make sure that we get people linked to care. And so it's going to be important, if we're not a treater as an HIV clinician or specialist like I am, if that's not the case, then you make sure that you know who in your community is, who can take care of those patients and be able to actually do that warm transition and handoff. So providers are key in this space, and all types of providers are really key to making sure we get those HIV tests, we raise awareness in the community, we offer prevention options, and then we get folks linked to care if they do come up with a positive diagnosis.